organise a theatre anyway, and then worry about a surgeon. Surely someone will be around. Whoa, Emma, slow down. Ibrahim puts his arms out to stop me with a laugh. I've almost bowled straight into him and his team on the stairs. He was my registrar 4 years ago when I first started working as an intern. I'm still grateful for his patience. Medical school teaches us how to perform CPR, but not how to treat conjunctivitis. Sorry, Ibrahim, I've got a supracondylar with a dying arm, I say as I rush past. Good luck, he echoes back, a floor away already. Mei-Ling calls me as I burst through the door into the bright hallway that links theatre and intensive care. What's up, Emma? She asks without greeting. After 2 decades as a surgeon, she must know that 4 missed calls from the hospital mean an emergency. 9-year-old, supracondylar, dominant hand, pulsus arm, heading to 2 hours post-injury, I summarise for her. There's a pause. I'm on the other side of town. Can you get started? Tell theatre I've given you permission. At least if you can reduce it and restore blood flow, by then I'll be there to help you pin it. I hesitate. Over the last 10 years, 6 as a medical student and 4 as a doctor, many surgeons have taught me bits and pieces of their craft. But I've never opened an operating theatre on my own before. I promise I'll be there, Em. Besides, you're an official trainee in a few weeks. You'll be fine. You've got this. Okay, I reply, breathless from the sprint up the stairs and the sudden extra surge in adrenaline. I wave my ID tag over the proximity reader and the doors to the theatre reception slide open. Hi, Em. You look like you found something urgent, Chitty the clerk observes. I lean over the desk and search her schedule for the names of the anaesthetist and nurse in charge of theatre today. Jeff and Layla, she says, pointing to the correct rows. Give me the patient's details. I'll take it into Layla and you can call Jeff. I scribble a note on the back of the patient's ID sticker with a whispered thanks and find Jeff's phone number in my phone. What have you got, Em? Jeff asks kindly. He's my favourite anaesthetist. He even tried to convince me to specialise in anaesthetics rather than surgery, so I know he'll take me seriously. He also knows that I'm acting up today. Supracondylar, dead arm, unfasted 9-year-old with a belly full of strawberry milkshake. That'll make things fun. Jeff is dry. Lucky timing. Most of the morning operating lists have finished, and we'll delay someone's start this afternoon. Do you have to wait for a boss? No. Mei-Ling said I could start. She's on her way. Are you sure? I know Jeff isn't being rude. I know that I'm unqualified, and it's his job to ask if the operation can be completed before he puts a patient to sleep. Mei-Ling is reliable. If she says she's coming, then she means it. But what if there's traffic? What if she has an accident? Then I realise that I know what to do. I know that I can finish this operation. And I realise that Mei-Ling, who never accepts a shoddy result, must think I can too. Otherwise, she wouldn't have given me permission to start. Yes, I say confidently. Okay, Em, we'll send for the patient. We'll work around the strawberry milkshake. Just don't be a typical registrar and rush us, okay? He called me a registrar, I think, and smile. It's the first time. I'm sitting on a stool looking at a satisfyingly pink hand when Mei-Ling bustles in, still tucking stray hairs under her clean blue balaclava. She inspects the small hand over my shoulder and studies the x-ray I've taken, but doesn't ask for a theatre gown or sterile gloves. Good work. Are you going to pin the fracture now or sit there grinning stupidly? She asks, a smile in her voice. One of the nurses hands me the drill with the pin loaded, the tool almost too large for my small hand. I strain to reach the trigger. Mei-Ling's still watching. Try your middle finger on the trigger with a big drill like that, she suggests. It's got more reach. I set the drill down to reposition, and it sits more neatly in my hand. Now screen with the x-ray so the pin's at the top of the elbow, and keep screening with the x-ray as you drive it in. The nurses cheer when the pin goes in on my first pass. Today's your last day here, isn't it, Emma? Mei-Ling asks as we walk to the change room together. I nod and wave at Layla, the nurse in charge today, and think that I must come back and say goodbye to her. But then, how do I say goodbye to everyone I've ever worked with? I came to this hospital as a medical student, stayed on as an intern, worked my way up. Now I've been one of the lucky few accepted into the training program.